Cancer has become an issue of public health concern in Kenya, contributing significantly to morbidity and mortality numbers in the society and placing a burden on the health system. It is estimated that cancer is the third leading cause of death after infectious diseases and cardiovascular diseases, with an annual incidence of 47,000 cases and 32,000 deaths. Breast cancer is the leading cancer in Kenya, with approximately 5,900 new cases reported annually. This accounts for 12.5% of all cancer cases and 20.9% of cancers among women. Of greater concern is the fact that awareness on early detection of breast cancer and uptake of screening services remain low. Only 25% of women aged 15 to 49 years have performed a self-breast examination, while 14% have had a clinical breast examination. The Ministry of Health recognizes that promotion of breast cancer awareness and education of women on breast health are important aspects in early detection of breast cancer. We have put in place an elaborate policy framework through the Kenya Cancer Policy 2019-2030 that was launched early this year, and the National Cancer Control Strategy 2017-2022. In addition, the government, through the Managed Equipment Services Project, has ensured that there is at least one mammography machine in each of the 47 counties. This is a deliberate effort to ensure that these services are availed closer to the people, so as to encourage our women to seek for breast cancer screening services. The Ministry of Health is equally committed to enhance healthcare infrastructure across the country, to support timely diagnosis and management of cancer through establishment of regional cancer treatment centers across 10 counties. As you are aware, early last month, His Excellency the President commissioned Kenyatta University Teaching, Referral and Research Hospital as a premier referral, training and research hospital in the country. It is important to note that at this same occasion, we witnessed the groundbreaking of the construction of an ultra-modern nuclear imaging center that is going to improve our capacity for diagnosis and treatment of the most common cancers. I am pleased to note that the Moi Teaching and Referral Hospital, another premier referral hospital, has recently acquired a set of radiotherapy equipment that is currently undergoing installation and commissioning. This morning, we had the opportunity to see this work that is being undertaken, and we were quite impressed by the level of work and the quality of the equipment that is being installed. We anticipate that the hospital will be able to start providing radiotherapy services before the end of the year. As I come back to the nuclear imaging center that I talked about at Kenyatta University Teaching, Referral and Research Hospital, that center will be producing isotopes, one of its kind, in sub-Saharan Africa. I think it is only South Africa that has a facility like that. The import of this is that those isotopes will be available for use by other facilities, our referral hospitals and hospitals that have the capacity to do this kind of work. And we are promoting at the national level that most of these facilities should have what we call the PET scan, which is the most sensitive instrument that is used to determine the level of cancer in the body and the stage that it is at, which is the reason why many of our people go to India and other countries, is because we do not have that technology. We have a PET scan in Kenya, in Aga Khan University. We will now be having one at Kenyatta University Teaching and Referral Hospital. And we are planning that most of our old provincial hospitals should also have a PET scan, so that these kind of services are closer to the people, more affordable, and the materials that they will use, the isotopes, will be readily available from the Kenyatta University Teaching, Referral and Research Hospital. I wish to highlight our collaboration with various county governments that has enabled the establishment of 10 chemotherapy centers across the country. We are now talking about chemotherapy, as you very well know. Cancer treatment is done with chemotherapy and radiotherapy. These are two aspects of cancer treatment. We now turn to chemotherapy. These 10 centers have made a significant contribution in availing cancer treatment services closer to Mwananchi. Further, it is important to note that we are finalizing the construction and equipping of 3 radiotherapy centers, one in Nakuru, one in Garissa, and one in Mombasa, that will further enhance access to this essential cancer treatment service. Of course, as we mentioned earlier, the one in MTRH will actually be commissioned before the end of this year. The Breast Cancer Awareness Month gives us a chance to raise our collective voices towards improving general knowledge around cancer and dismissing misconceptions about the disease. I'm glad to note that throughout this month, various stakeholders have committed to use various platforms to educate our people on cancer prevention and the importance of screening and early detection. We need to sustain this momentum, not just during this month of October, but throughout the year, so that the message on cancer awareness and prevention can become a way of life for us. As we launch the Breast Cancer Awareness Month activities today, I call upon all our women to take advantage of the screening equipment that is available across the country to know their status. Remember, early detection of breast cancer can save your life. Finally, I wish to reiterate our commitment as the Ministry of Health, working with all stakeholders to halt and reverse the burden of cancer in our country. Indeed, working together, we can make a difference.